It's hard to imagine a primary care practice with a lot of older patients that doesn't have a big chunk of patients who are suffering from some variation of acute or chronic pain, mostly back pain, but also neck pain, pain from neuropathy or stenosis, you name it. The older we get, the more stuff hurts. It's a fact of life. The other constant with older patients, besides the pain itself, is that most patients don't want a prescription drug for their pain. Interestingly, patients don't differentiate a lot between opioids and non-opioid pharma treatments. They don't say, I don't want an opioid, or even, I don't want something addictive. What they say instead is, Doc, I don't want another pill. Something else they don't want is to be referred out to a pain management specialist. That's just not an experience most people enjoy. They'd much rather you treat them because they know you and they trust you, especially if those treatments are covered by insurance, and so would you, right? The answer is a medical technology that has been helping physicians treat pain patients for over 3 decades and has been successfully used at some of the most elite healthcare facilities in the country, including the Cleveland Clinic, Loma Linda University, Columbia University, and over 3,500 physicians' offices nationwide. The Matrix by NeuroMed is so popular because it works by delivering the broadest range of treatment options on the market, meaning you'll have a solution for nearly every type of acute or chronic pain. Additionally, no other device on the market is FDA cleared to deliver electroanalgesia frequencies as high as the Matrix. This range of frequencies is what allows the Matrix to stimulate, facilitate, or inhibit the electrical signal depending on the patient's condition or diagnosis. The Matrix does with electrical signals what narcotics do with chemistry. A common question about the Matrix is, how is it different than a TENS unit? TENS units are topical stimulators that work by creating a sensation that distracts the brain, giving it something to pay attention to other than the pain. They typically operate using frequencies of 1 to 250 pulses per second and a very low dosage, about 25 milliamps, and they work fine as long as the patient is using the unit. Once you take the unit away, the distraction goes away too, and the pain comes back. The Matrix is FDA cleared to operate between 0.1 and 10,000 pulses per second and up to 100 milliamps. It goes so fast the nerve cells can't recover, and they become depolarized, which blocks their ability to transmit the pain signal. So while a TENS unit can only stimulate and facilitate nerve functions, the Matrix can also inhibit them. A second common question is, how long do the treatments last? And this is another thing that's brilliant about the way the Matrix operates. The duration of action extends with multiple sequential treatments. Typically, a patient reporting a 10-level pain will feel their pain reduced to between 0 and 5 after a single 25-minute treatment, and that relief will last between 2 and 4 hours. After the second treatment, the relief will last 4 to 8 hours, then 8 to 16, and so on. It's a cumulative effect. After an initial course of 15 to 20 treatments, most patients just return for a maintenance dose about once a month, just like they're getting a prescription refilled. It's that easy. Who's it for? Patients with most types of chronic or acute pain. This includes disc issues, arthritic pain, neuropathic pain, etc. Unfortunately, it doesn't usually help drug seekers or people who identify as the person whose pain is so bad nothing works, but the vast majority of patients can get tremendous relief from electroanalgesia by NeuroMed. The specific reimbursement depends on the patient's diagnosis and the capabilities of the specific device, so it's important to note that while electroanalgesia by NeuroMed is covered by Medicare, Medicaid, workers' compensation, and most private insurance, many electrical stimulation devices on the market are not reimbursed at all. Clinically, it's hard to find another device that delivers such dramatic improvement in such short time. This device literally changes patients' lives, and it can do it in very short order. It's pretty damn impressive, and you really should at least just see it in action. So, think of your 5 toughest chronic pain patients. If you'd like to know more about how electroanalgesia by NeuroMed can help them and dramatically improve your practice, call your trusted local advisor and schedule a complimentary consultation today.